Skin-to-skin contact between the mother and the baby after birth is beneficial for the health of both. Even when all the research is from the past few decades, we must recognize that this has been done for centuries by traditional cultures. This practice stopped in the West when childbirth began to be performed in institutions. This reduced the mother-child mortality rate, but it also caused the loss of beneficial practices like the skin-to-skin contact that is slowly returning. First, I will mention the benefits of skin-to-skin contact, and later, I will talk about how to implement it. This practice provokes the release of oxytocin from the mother, the love hormone. Besides facilitating the bond between mother and baby, oxytocin stimulates contractions, which reduces postpartum hemorrhages. Besides, it's the hormone in charge of the production of milk. We can say that skin-to-skin contact works towards breastfeeding by stimulating the release of oxytocin and by allowing the mother's chest, with its warmth, aroma, and texture, to be available to the baby. There are numerous studies that show how the skin-to-skin contact immediately after birth helps with breastfeeding in a short and long-term basis. Another benefit is the reduction of cortisol in both mother and child. This hormone is closely related to stress. The baby will regulate in a better way their breathing and their heart rate, with lower chances of presenting hypoglycemia, which is low sugar levels in blood, will cry less, and decrease their irritability. Besides, the contact will allow them to regulate their body's temperature better, to stabilize it within the normal ranges. It also decreases the possibility of postpartum depression on the mother. It increases positive affectivity and adapting to the signs of her child. How to implement this contact after birth? After informing of the benefits to the parents, it's important to ask her if she wants the skin-to-skin contact with her baby immediately after birth. If she doesn't want it, or her health conditions are not optimal to do it, but the father can, skin-to-skin contact with him can be offered. That's why it's recommendable for them to wear a shirt that can be easily opened. If the mother wants to have contact with her baby after birth, she must be invited to uncover her chest and abdomen. If it's possible, she should be in a half-sighting position to support the newborn directly with her skin. Meanwhile, neonatologists can clean the baby and cover the mother with a warm towel. Then, the mother is asked to offer her breast to the baby, but not to force it. The natural attachment is preferred. It's not important for the baby to latch to the breast during the first hour of life. What matters is that this valuable contact gets established and that the baby has the possibility of eating if desired. While the mother and child bond, the obstetrician cuts the umbilical cord, takes a blood sample from it, and stimulates the release of the placenta. The neonatologist evaluates the newborn with the Apgar test. The skin-to-skin contact with the mother or father must be favored during the stay at the hospital. Many investigations showed a decrease in pain from babies that are in contact with their caretakers while they had to undergo interventions like vaccines. If we could ask a baby where they would like to be, I'm sure they would answer that they want to be close to their mother, under her protection, love, and security.